Hello everyone, this is Samson from VODAN Africa. I'll now be demonstrating the different tools that we use in VODAN Africa. I'll demonstrate three cases, an aggregate data set that's collected from the different health facilities, and also a research data set that we collected for COVID, and a data set on either referral hospital. I will start with the first one, which is an aggregate data set from VODAN Africa, which we will be looking at shortly. As you can see, we have lots of data that's collected from different places, and this is an aggregate data. We can visualize it like this. When you see the data here, we have different kinds of health facilities, private, public, and from 8 countries. I think for a better visualization, let's try to filter the data and look at the private health facilities only, so that we can see. So as you can see, we have these private hospitals, KIU hospital, and we have Beacon of Hope from Nairobi. For better visualization, we might look at it in a form of a tree. So some are big hospitals, some are small, and the others are medium. So we can try to see the different levels. We might look at if we are following a pandemic, we might also like to see which one of the health facilities are reporting lately on a monthly visit. Like this one has. So this one, the KIU has reported, and Pinwane, as well as most of the health facilities are not reporting lately on COVID, maybe due to the number of cases has declined, or could be other reasons. We can also look at the total OPD visits in the different health facilities that we have. So like I said earlier, this is more of an aggregate data, and it would be difficult to see linkage, but we will try to see in when it comes to either in a more detailed manner. Let's also now go to the research data on COVID. We can see that the research data was collected before we started verification. So it was collected through other tools, and it looks like this, and it's usually difficult to visualize when it is in this format, but we can see what it looks like in a form of let's take around 1000 of the cases and try to see what it looks like. It's usually easier to look at it using instead of this format to see in this format. We have UNHCR who has supported this patient. There are COVID cases, some migrants, for instance, this one is an asylum seeker. We can drill down more by going what were the individuals who had symptoms and who were from Libya. Yeah, we can query the data set and visualize it better when and if we are, for instance, doing a qualitative research and we want to dwell more, then we can start by first visualizing them, and then going to each of the individuals and taking more data. For instance, if we are interested in who is has symptoms and is helped by IOM or any other organization of choice, and we will have the result like this. Now let's go to the case of Ida Referral Hospital, where we do have not only aggregate data, but data of the different patients who have come to the health facilities. For instance, let's see what syphilis distribution looks like in that hospital, and we can look at the different results. And in either we have three categories. For one, for those who are who have syphilis and who are reactive, or who are non-reactive, or who are not the test ND means the test is not done. When we see the reactive cases, these are relatively smaller to drill down more to, so I will go to see those that are reactive only. So these are the reactive cases, and if this was another disease which we really want to monitor, if it's going to go into a pandemic level or anything, then we would be looking at it, or look at each of the cases based on the dates. How many have been reported on this date, for instance? Yeah, and then what was the age like? What was the gestational age like? And we can do lots of assessments as to what's happening to each of the patient cases. So this can help us in also looking at for the case of treatment, are those who are reactive in the early days or in the late days. We can, based on their gestational age, we can also relate that as well, and try to see, for instance, most of them were when their gestational age is in day 20, in the 21st week, I think. We can look at how many were less than this or greater than this. Yeah, and we can do lots of things. And we also have OPD data that we work with, so we can also look into what the OPD data looks like. As you can see, we have lots of OPD cases, and they can be male or female. Most of them are diabetic patients. If we look at, we're looking now at the the female cases, which are 54. 44 triples. We might as well be interested in the male cases in this case, and we have 60 of them, which are much higher than those. We can disaggregate it by the number of visits, by gender, and look what the distribution looks like. If you are interested in a specific disease, for instance, if you are interested in type 2 diabetes or anything, we can look at what the data looks like, and it's usually easier to, for instance, we can see both for both sexes, and we can also have a specific disease that we want to track, and we can specifically query that as it unfolds. If it is a rare kind of disease, or if it is a disease that is pretty common. This we have tried to look at how we do queries on different at different levels, but the data is available in a form of a triple store, and each uh, facility uh, has those functionalities. Yeah, thank you for following me up.